welcome to another Top Doctors Online interview where we speak with one of our leading specialists. Today, we're very fortunate to be joined by leading consultant gynecologist, Mr. Amer Raza, to speak about robotic and minimally invasive techniques in gynecological surgery. So welcome, Mr. Raza. Thank you very much for joining us today. Would you like to introduce yourself and tell us a little bit about your areas of expertise or background?
My name is Amer Raza. I'm a consultant gynecologist in Chelsea and Westminster Hospital. I'm the lead consultant for endometriosis and robotic surgery. I'm also the lead consultant for International Centre for Endometriosis in Cromwell Hospital, London. My special expertise is in robotic and keyhole surgery.
Thank you very much for joining us today and speaking with us. So, as I mentioned, we're going to discuss minimally invasive, otherwise known as keyhole surgical techniques, as well as robotics in surgery for gynecological conditions. So to start off, Mr. Raza, could you explain exactly what is meant when we say robotic and minimally invasive surgical techniques?
Robotic keyhole surgery is an extension to the conventionally known laparoscopic surgery. In a conventional laparoscopic surgery, the instruments are inserted inside the abdomen and a doctor stands next to the patient's bed, holds the instrument manually in their hand and watches the television screen in front of him and operates inside the abdomen. However, robotic surgery now allows us to insert the small instrument inside the abdomen, connect them with the robotic arms, and then sit in a console and control the same instruments from a distance from that patient. These robotic arms actually allows the doctor to be very precise and very accurate in operating inside the abdomen. In conventional surgery, in laparoscopic surgery, as the doctors control the instruments, though with our experience, we're quite good and very expert in doing what we do, but there is still a human factor of either views watching on the television screen, a tremor in the hand, or accuracy and limitation of the instrument movements. The normal conventional instruments, laparoscopic instruments, have very little and limited movements. They can either rotate or we can move them up and down. But robotic instruments have a small wrist attached to them, and this allows us to actually move the instrument in much more directions with much more flexibility, allowing us to do more complex surgery in more difficult parts inside the abdomen. Robotic surgery, therefore, is much more preferable and a much better form of surgery as compared to conventional approach.
So people who are listening to this interview who are going to require some type of gynecological surgery may well be wondering if all patients are suitable for robotic, minimally invasive procedures. Is that the case?
Robotic surgery is absolutely suitable for 95% of the patients. So initially, all the patients who can have keyhole or laparoscopic surgery, they're all suitable for robotic surgery. But as I said before, that robotic surgery allows us now with precision and accuracy to do more complex operation. Actually, the operation which were being done by open surgery and not laparoscopic surgery because of the limitation of instruments and technology. Now with the robotic approach, we can do those operations as well with the robotic approach. For example, if there is a large fibroid uterus, the conventional approach was that because laparoscopic instruments have very limited movements inside and complexity, therefore, we will send them for open surgery. Now, because of robotic approach, it is possible to remove larger fibroid and more fibroids with the help of a robotic approach. I will give another example. If it's a large uterus needing hysterectomy, but it's a large uterus, therefore, the patient's operation will move towards the open approach than a robotic approach. Now, robotic surgical instruments and the visuals allow us to do that approach robotically. So actually now we're doing much more and many more operations robotically than what being done in a conventional laparoscopic surgery. So, and this thing is getting better with time.
Thank you, Mr. Raza. So for the next question, I'm sure you would agree, for patients going in for any type of surgery, it's really, really important that they're aware of both the advantages and the disadvantages of any surgical approach. So what exactly are the benefits and risks associated with robotic keyhole surgery techniques in gynecological surgery?
That's absolutely right, that every operation will have its benefits and risks. And before making a decision, we need to look at those pros and cons and to make the judgment, good decision for the patients. If we look at the robotic surgery now, we know that the precision of instrument is better. We know the visuals are enhanced 3D that allows a surgeon to be very precise during the operation. They have the much more accuracy, and there's a much less blood loss, and there's a more radical removal of the disease from inside, because doctors can see in much more detail. An example I can give you, then when we operate laparoscopically inside the abdomen, we were never able to see nerves so well, even though we were able to, but small nerves were missed. But now, because of this enhanced 3D visuals, we're able to see much more detail of the anatomy and small nerves, so we can do nerve-sparing surgery. So in terms of benefits, there's a less risk of infection, there's an early recovery because there's a less tissue trauma due to the accuracy of instruments, earlier discharge to the hospital from hospital, and also earlier return to work as well. I've also observed over my last 300 cases that there is also less post-operative pain as well, because inside the abdomen, the tissue trauma is less, but used to be either from a conventional open surgery or laparoscopic surgery. So that's definitely hugely benefit. On the risk side, there are risks like any operation. There is a small risk of infection, injury, and bleeding. But comparing to open surgery is definitely much more superior as compared to laparoscopic surgery. We're finding out that is also beneficial and better and less risky than laparoscopic surgery.
Okay, so it sounds really like the benefits do outweigh the risks. So for people getting ready for gynecological surgery, thinking about if these techniques can be applied in their case, what conditions can actually be treated in this way?
Generally, every condition which we do in the abdomen gynecologically can be accomplished with robotic surgery. But if I name few, endometriosis, from mild endometriosis to very complex endometriosis involving bowel, ureters, urological system can be managed robotically. Fibroid uterus, hysterectomy, myomectomy, removal of fibroids, these can be accomplished with robotic surgery. We can also do tuboplastic surgery, correcting cesarean section scar, removing abnormal ovarian cysts from the ovaries. All these operations can be completed with a robotic surgery.
Fantastic. Thank you, Mr. Raza. So finally, let's speak about the recovery period that follows surgery of this type. I know you've mentioned a reduced amount of post-operative pain. What does this recovery period actually look like for patients, and how long does it normally take to recover following minimally invasive robotic surgery for gynecological problems?
Recovery after any operation depends on how much trauma we have caused during operation. And as I said before, when it comes to open surgery, there's a big cut of the abdomen, hence longer recovery, and a conventional recovery time in those approaches was 6 weeks. With the laparoscopic surgery, there was a dramatic change to 2 weeks recovery as compared to 6 weeks in many common gynecological procedures. But robotic surgery has now taken us one step further because there's a less tissue trauma, and we can operate on a very less intra-abdominal pressure. Mean when we put the gas in the abdomen to be able to operate, now we can operate on a much lower pressure as compared to conventional. And I've seen the recovery in robotic surgery is much quicker. So in a conventional way, I would say that most patients after robotic surgery can go home on the same day as a day case procedure, or after one night stay, they can be all discharged home. 60% recovery happens within the first week of their operation. And when I see them on day 7, 60% recovery is complete, and another 40% recovery will be complete within the next week. So 2 weeks is the most common time when people can return to their normal activities, right from going gym, driving, back to work can be done. So from a conventional approach to a robotic approach, we have seen a huge benefit in terms of recovery from the operation.
Thank you so much, Mr. Raza, for joining us today and sharing your expert insight on these advanced surgical techniques. I'm sure it's been really interesting, informative, and reassuring for women who are expecting to have gynecological surgery. I'd just like to remind anyone who does require some type of surgery for a gynecological condition that you can schedule a consultation with Mr. Raza by visiting his top doctor's profile. Delighted to have spoken to you today, Mr. Raza. Many thanks again.
Thank you very much. Thanks for your help.